central canals. Now a central canal plus its surrounding lamellae, central canal plus the surrounding rings of matrix make up a structure known as an osteon. So this whole thing is an osteon, this whole thing is an osteon. So from there to there, the whole structure is an osteon. Osteon is the central canal plus these concentric lamellae, which are these rings of matrix. Okay. Each ring is called a concentric lamella. Concentric lamella. Okay, in between the lamella, you can see those dark spots right there. Those are the lacunae. Singular is lacuna. A lacuna is a cavity. And the lacunae are occupied by mature bone cells called osteocytes. And then radiating out from each lacuna, you can see those little delicate channels that look like spider legs. Those are the canaliculi. Okay, blood vessels and nerves enter the bone through the nutrient foramen. The foramen is a hole through a bone. So the blood vessels penetrate the bone, and the foramina open into these perforating canals, also called a Volkmann's canal. So here's the perforating canal, which crosses right through the matrix and then feeds into the central canal.
It has only technology.
Okay. So go. These are the circumferential lamellae. Circumferential because they are parallel to the bone surface, as opposed to the concentric, which are the rings. And then on the inside, some of you can airdrop it to others. Okay, this is the spongy bone on the inside we see. And the spongy bone is covered with this gray layer right here. That is the endosteum. Endosteum. E-N-D-O-S-T-E-U-M. And it's a layer of reticular connective tissue. And all these spaces of spongy bone would be filled with bone marrow.
With what?
Bone marrow.
Okay.
Okay, cut.
Cut? That's it?
Did it? Okay. So here's the skin model, and we have 3 different sections. Each section is taken from a different part of the body. This section is taken from the palm or the sole. This is taken from the axilla or the armpit. And then this section is taken from the scalp. So here is the most superficial layer of the skin is the epidermis. Okay, and the epidermis has 5 layers in thick skin, 4 in thin skin. The 5 layers in thick skin from deep to superficial are the stratum basal, right there. Then the stratum spinosum. Then the stratum granulosum. Then the stratum lucidum. And then the most superficial layer is the stratum corneum. Okay, this is thick skin, which we find on the palm or the sole. The rest of the body is covered with thin skin, which you can see has a relatively thin stratum corneum. Sorry, right here, stratum corneum. And thin skin doesn't have this layer right here, the stratum lucidum. Okay, so thin skin has only 4 layers: stratum basal, stratum spinosum, stratum granulosum, and stratum corneum. Does not have a stratum lucidum. Okay, below the epidermis is the dermis, so all of this is part of the dermis. Okay, then below the dermis is another connective tissue layer, the hypodermis, which is not considered part of the skin, but we talk about it at the same time. And then hypodermis, composed predominantly of adipose tissue, like we see here, these fat cells, is called subcutaneous fat. Okay, now in the dermis we have the nail roots and the hair roots, the nail roots and the hair follicles, also the glands. Okay, this is a hair. Here's the hair follicle. Attached to each hair is this muscle, a piloerector muscle. Okay, these receptors in the skin right here, they're called tactile corpuscles, also called Meissner corpuscles. Receptors for light, touch, and texture. And then deeper in the skin we have these, which are the lamellar or the Pacinian corpuscles. And they are receptors for light, touch, tickle, and vibration. Okay, the skin has 5 types of glands. I'm going to talk about 3. There are 2 types of sweat glands and then the sebaceous glands. These are the sebaceous glands. Sebaceous glands produce an oily secretion called sebum. You can see they're kind of short shaped like flasks, and they open into a hair follicle. The two types of sweat glands are apocrine sweat glands and merocrine sweat glands. This is an apocrine sweat gland. Apocrine sweat glands are found on the regions of the body covered by pubic hair, axillary hair, and beard hair. And since this is taken from the axilla, that's how I know it's an apocrine sweat gland. Also, because the duct is opening into a hair follicle. So apocrine sweat glands, the duct always opens into a hair follicle, never on the skin surface. Okay, this, and this, these are the other type of sweat gland, which is a merocrine sweat gland, okay, which are found everywhere on the body. And if we follow the duct all the way up, we see that it opens into a sweat pore on the skin surface. So merocrine sweat glands, the duct always leads to a sweat pore on the skin surface. Okay, got it.
Can you do the skull?
Okay. From this view, I can see the frontal bone right here, single frontal bone. There are two parietal bones, right and left. Now each parietal bone is surrounded by 4 sutures. Here's one, that's the coronal suture at the anterior margin. And then there is the sagittal suture right here, between the parietal bones. Then there is the lambdoid suture right here at the posterior margin. And then, you can't see it here, but there is the squamous suture, which would be right there on the lateral side. Okay, this right here is the temporal bone. Okay, on the temporal bone we've got the zygomatic process right there. We've got the mastoid process right there. We've got the pointy styloid process right there, also on the temporal bone. We've got the external acoustic meatus right there, opening into the ear canal. This bone is the zygomatic bone, and on the zygomatic bone we have the temporal process right there. You can edit that out, right?
That's inverse.
Okay, so the temporal process is on the zygomatic bone. Zygomatic process is on the temporal bone. This bone right here, that's part of the sphenoid bone. It's part of the greater wing.
But just that part, or that
Yeah,
whole
no, just
entire-
this part. You can see the suture right there.
Sphenoid bone.
That's the suture separating the temporal bone from the sphenoid bone.
Okay.
Yeah, so that's part of the greater wing of the sphenoid bone. Okay. In this view, I can see the nasal bones. There's a right and left. The mandible, the maxilla, forms the upper jaw. There's actually a right and left maxilla. Can't see the intermaxillary suture here. Okay, this bone right here, forming the lower part of the nasal septum, is a vomer. And then the upper part of the nasal septum, right there, that's part of the perpendicular plate of the ethmoid bone. Okay, here's the occipital bone at the rear of the skull. Okay. This bone is the mandible, the lower jaw. Okay, now from this view of looking in the floor of the cranial cavity, I can see this structure right here is the sella turcica. Yeah, part of the sphenoid bone. Here are the greater wings, the lesser wings of the sphenoid bone. And then this right here, that's the greater wing of the sphenoid bone. It's hard to see it there, but there's a suture separating the greater wing from the temporal bone. So here's the greater wing, and then the rest of the middle cranial fossa is formed by the temporal bone. Now the lesser wings guard the optic canal right there,
Optic canal.
which is a passage for the optic nerve, and you can see it comes right out into the orbit. Okay. Now this bone
Is that
forming
more?
most of the anterior cranial fossa is part of the temporal bone.
Temporal.
Yeah, now this right here is the cribriform plate. This whole thing right here, this small area, it's a cribriform plate of the ethmoid bone, which includes the crista galli, that blade right there. It's a point of attachment for the dura mater. So that is the crista galli, which is on the ethmoid bone.
What about the holes that is
I'm gonna
in
do
the
that.
crista galli?
Yeah. Well, on each side of the crista galli is a depressed area. Those are the cribriform foramina. Yeah. from an inferior view, I can see that large hole right there is the foramen magnum. That's where the spinal cord meets the brain. Brainstem meets the spinal cord. These are the occipital condyles, which articulate with C1. Okay. Here's the hard palate, this whole thing. The anterior portion of the hard palate, formed by the palatine process of the maxilla. Posterior portion, formed by the separate palatine bones. There is a suture separating them. I just can't see it very well in this skull. Okay, now on the temporal bone, we have, from this view, we can see the mandibular fossa right there. It's mandibular fossa, which articulates with the mandibular condyles of the mandible, form a hinge, the temporomandibular joint. Okay, then, also on the temporal bone, we can see this irregular opening right here, just medial to the styloid process. That's the jugular foramen. Jugular foramen, and then anterior to that, right there, we have the carotid canal, passage for the internal carotid artery. Okay.
What about the? I think it's the spinosum foramen. Isn't that?
Yeah.
Inferior to the carotid canal?
Well,
right over.
yeah, we've got the.
Yeah.
On the
anyway.
sphenoid bone, there are a number of foramina. That's the foramen ovale.
Okay.
And that's the foramen spinosum right there. And the foramen rotundum is right there. Foramen rotundum and ovale are passages for two branches of the trigeminal nerve.
Good.
Okay, there are 7 cervical vertebrae, C1 through C7. And this is missing C1. C1 is
The
here.
atlas.
It's also known as the atlas, yeah. And you can see that. The superior articular facets of C1, they articulate with the occipital condyles, just like that, and that allows for a motion of the skull as in gesturing yet, so the condyles rock back and forth on those facets. Okay, C2 is called the axis. So C2 is the axis, and its most conspicuous feature, here C2, is this knob right here, that's the dens, or the odontoid process. Okay, and then you've got C3 through C7, and all of these cervical vertebrae have the transverse foramina right there, okay, which allows passage for the vertebral arteries and veins. Only these cervicals have the transverse foramina. No other vertebrae have it. Okay, then there are 12 thoracic vertebrae, T1 through T12, which have ribs attached to them. No other vertebrae have ribs. There are 5 lumbar vertebrae. L1, L2, L3, L4, L5. There's the sacrum and then the coccyx, which is not here, but the coccyx is
Here.
right there.
And then it's called the top sick.
Coccyx.
Coccyx.
Okay.
These are the intervertebral discs.
The disc, yeah.
These are the spinous processes of the vertebrae. These are the transverse processes. These are the bodies of the vertebrae.
What is the name of this?
Just the body.
The
Also
body.
called the central
Okay.
and body.
And that's a lumbar.
This is a lumbar, yeah. So the vertebral foramen, spinous process. These are the transverse processes.
Facets.
These are the superior articular facets or processes.
On the exam, if you ask for the name and then we say facets, is that
Fine.
okay?
Fine.
Okay.
Okay, there is one coracoacromial ligament. Coracoacromial, going from the coracoid process to the acromion. Coracoacromial. Okay, there are 2 coracoclavicular ligaments going from the coracoid process to the clavicle. So here's corticoclavicular, and then right there is the second corticoclavicular. Okay, there is one acromioclavicular ligament. That's acromioclavicular. And there is one coracohumeral ligament right here. It's coracohumeral. And then there are 3 glenohumeral ligaments going from the glenoid cavity to the humerus. Here's 1 glenohumeral. Here's 2 glenohumeral. And then a third is on the posterior side. That is also glenohumeral. Okay, so that should be 8 ligaments from this model. Maybe knee joint.
And that's a shoulder or?
This is the shoulder joint, yeah.
Okay,
And
right.
here's the knee joint. This is a right knee. This right here is the quadriceps femoris tendon, which extends to the patella. Then from the patella to the tibial tuberosity, this is the patellar ligament. Patellar ligament. Now, this is a right knee, and on top of the condyles of the tibia is where I find the menisci. Singular would be meniscus, just a C-shaped cartilage. So here is the medial meniscus on top of the medial condyle of the tibia, and then the lateral meniscus is right here on top of the lateral condyle of the tibia. See, they're C-shapes, that's why they're called meniscus. Okay. This right here, going from the lateral epicondyle of the femur to the head of the fibula, is the fibular collateral ligament. Fibular collateral. It's also called the lateral collateral ligament. And then on the medial side, going from the medial epicondyle of the femur to the proximal end of the tibia is the tibial collateral ligament, also called the medial collateral ligament. And then we have the cruciate ligament, and attaching to the anterior side of the tibia, crossing the joint and then attaching to the posterior side of the femur is the anterior cruciate ligament right here, or the ACL. Okay, then attaching to the posterior side of the tibia, crossing the joint and attaching to the anterior side of the femur is the posterior cruciate ligament, so this is the PCL, posterior cruciate ligament.
Technically, that one's torn.
Yes. Yeah.
And the ACL is what's going underneath it?
This is the ACL, yeah. So they
Right.
cross each other in front of it.
Okay, got you. And that's the posterior view, right?
This is a posterior view.
And then which one is that one?
This is the tibial collateral ligament, also called the medial collateral ligament. Okay.
Keep on teaching.
The ACL, all we can see of it is right here.